In the context of COVID, Cheshire actually includes Cheshire East, Cheshire West, Warrington and Halton. Through COVID, each of the organisations in Cheshire took on a slightly different operational role through this, with some being very volunteer and community focused and some of us being slightly more VCFS focused. Overall, I would say within Cheshire and Warrington, each organisation rose to the challenge in their area, and there is a very strong feeling that they've improved relationships with the voluntary sector groups and their statutory partners, and that the value of infrastructure has increased, and also that we're going to have quite a strong strategic legacy in place after this at a Cheshire level and a Cheshire and Merseyside. So some of the challenges we faced, which everybody's kind of faced in terms of capacity, whether that's people capacity or money capacity, meeting the demand that we've had, how do we respond quickly, how do we prioritise what meetings with partners that we attend, how do we change our services, how do we operate remotely, and how do we manage IT elements. I think the key for us in Cheshire and Warrington is that I feel that we've all been very visible, both at a place level and also at a Cheshire level. There is actually a lot of respect and trust between the infrastructure bodies as a partnership, so we do promote and support each other and kind of work as champions, and that has very much helped us strategically in terms of raising our profile, because we don't just talk about ourselves. Of the partnership has very much created a vehicle through which we can promote infrastructure organisations and enable statutory organisations to access the sector. So we've been promoting this out, and I've had really good feedback from our partners saying they're really looking forward to working with the group. They think it's going to fill a gap, and they see it as a gateway into the sector. They see us as the place and the way they can engage with the sector. And I think there is a challenge for us moving forward around how do we prioritise and how do we make sure we're doing what we really need to do, but not necessarily doing everything.
Big area with a small population and lots of very local approaches, and that's a really positive thing because people really own their community and make a difference in those communities. But we have very little infrastructure. There's very few people, so there's very little money, and the infrastructure we have is very small, very good at some of the stuff it does, but actually very difficult to cover the whole county. We do have some very good and improving working relationships across the statutory sector, and also what we've been doing in the last 10 years in Cumbria, because of all our emergencies, is having the conversation, talking to people about how they respond, whether they have a plan, how they're prepared, how the statutory sector allows communities to play a role in response during an emergency. What I want to talk about today is the Resilience Coordinator post, and that's where Cumbria CVS is hosting a post working with the LRF on coordinating community activity, so far as you can ever do that, to assist the LRF to have a relationship with the third and community sector. The ongoing work in supporting COVID-19 is about supporting communities in response and recovery. Because of the Community Resilience Post, we're very involved in looking at the National Community Resilience Standard. And that's a really important thing for us all to get on top of with the LRFs, because the recommendation is that LRFs should have a Community Resilience Post. It's really great that our Community Resilience Coordinator gets on really, really well with the people she's working with. That's Carolyn Otley, who many of you will know. But actually, if Carolyn wasn't there, how would that work? Would we actually be able still to carry on with that, or is it about relationships rather than structures? We're clear about the different areas of work we do. I know we've also got Cumbria Youth Alliance on the call, who are the communities will do what the communities want to do. They don't need to be tramlined and put into systems and processes. And particularly with over 300 groups having come up through COVID, they're not all going to follow the same pattern. And that's sometimes quite difficult for our statutory sector partners to understand.
think and there's several of my GM colleagues on the call as well. I think that the first thing I'd say is how quickly all the local infrastructure organisations transformed, but we didn't all start in the same place. So, you know, we weren't all equally resourced or positioned. Local structures, local relationships, massive variation across Greater Manchester. For those of you from outside, one of the things I've reflected on since, which is something I'll come back to, is that while we had a lot of strong relationships, we saw the truth about some of those relationships. And I think one of the things I've seen is us spending a lot of time in meetings, but perhaps not enough time in. So wanted to look quickly at volunteering as a case study. An early win for us in Greater Manchester was setting up GM volunteering. So we managed to work with the Mayor's office, who obviously wanted to be seen to be doing something, getting something out quickly, that rather than setting up his own volunteering initiative and his own programme and all, just use the convening power and the profile that you have to point people to all the local points of engagement with volunteering. So we set up a special website which said, right, if you're in Salford, you go to Salford CVS. If you're in Bury, you go to Bury VCSE. And the traffic that came through that was fantastic. But it also meant we avoided a huge waste of time in the potential for duplication of effort. I think we saw a difference depending on the capacity and the structures in local boroughs about whether volunteer centres and infrastructure organisations did, if you like, direct coordination, matching volunteers with individual service users, or brokerage. In Manchester, simply because of the scale of the operation, we did brokerage. I think there's an interesting, very quick piece of work to do to reflect on those organisations in infrastructure that have social prescribing and those that don't, and see what the correlations might have been. I think one of the things, just picking up on something Caroline said earlier, was we decided right from the start that we would already have enough to do to adapt to working in a different way to do what we could already do. So therefore we had to learn how to walk differently. What we didn't want to do was learn a new skill. So we tried very hard to transform all our existing operations and pointed the whole of Macc into the COVID response work. But it was all about transforming things we already thought we were good at, rather than trying to set up new things. In telling this story, remember, we always all carried on supporting the VCSE sector, because we'll talk about all the new stuff that we did and sometimes forget the bread and butter stuff of helping those organisations adapt new health and safety procedures in COVID.
The picture in Lancashire is pretty much the same as elsewhere. So in Lancashire, we've got a really strong infrastructure system in place. We've got LACVS, who are a partnership of 8 organisations spanning the whole of Lancashire, providing your traditional infrastructure support. But then we've also got infrastructure providers who offer specific support to specific communities as well. Recognition and understanding of the value of infrastructure. And yet, when COVID hit, it's exactly this undervalued and underfunded system that responded to the emergency in a manner that's becoming of our sector. So we're unrecognised, undervalued, but the system still continues to provide support to the wider sector, regardless of the fact that we are heavily utilised by the statutory sector. And yet many of the organisations, and I know this isn't just a Lancashire picture, it's national, we don't receive a penny for our efforts. We do this because it's what we were set up to do. So what added to this issue is the fact that there is under-recognition and we're undervalued as a sector. The statutory sector is dismissive of the need for infrastructure, but then we've also got funders who are equally reluctant to fund the system because, and I understand why, prioritising service delivery, but there isn't that acceptance that the VCFSE needs support mechanisms to be able to attract funding and then to be able to measure and deliver impactful work. So as infrastructure services, and I think this will be a national thing again, we've had to diversify our and to generate income. So as the Lancashire BME network, we've had to take on service delivery. We've had to look at other means of income because we don't get any infrastructure income, and without that infrastructure income, we can't continue to support the sector. And I've heard this a couple of times from other people, which is equality and inclusion not embedded in most, if not all, organisations? So why do we need a BME infrastructure system? So we've been in existence for nearly 2 decades, and we've supported hundreds and hundreds of BME groups over the last 2 decades. But recently, over the last 7 months, the ask of ourselves has rocketed. So I've asked myself the question again, why are groups coming to us? Why are they not going to wider infrastructure services? And for me, the answer to that question lies in the fact that we are specialists in what we do. So equality and inclusion isn't embedded in what we do, it is what we do. And that's what we're about. So we offer a culturally competent and nuanced support service that meets the needs of BME VCSE organisations. And now we've got an extra spotlight thrown on our sector through the identifying of systematic discrimination within systems, and especially in statutory provision. And who better place to support the BME VCSE than an organisation with lived experience? And above other organisations in being funded is partly due to perceptions and bias, whether that be conscious or unconscious bias. We're not attracting the same level of funding. So even though many parts of civil society can say that they are underfunded, there is a long-standing and historical issue around BME organisations being poorly funded and not being empowered to challenge and create change. So as the saying goes, we feel like we shouldn't bite the hand that feeds us. So we're very reluctant to challenge the status quo. So when you're a BME infrastructure organisation, you've got the existing challenge of being underfunded, but because infrastructure is not sexy, nobody wants to fund us. We've got that additional challenge and that additional layer, which is not only are we BME, but we're infrastructure. So we've got the additional challenge of attracting funding. Spotlight goes off this agenda, we're going to be back to not square one, but somewhere close to that. So my question always is, how do we make a change? Is short-term funding the answer? Because a lot of funders, and we've been the recipients of funding, so we're very grateful, but is short-term funding the answer to a long-term problem? And for me, the answer is no.
This isn't probably going to be news to anyone, but some key challenges for groups in our sector that we focused on in the Liverpool City region relate to funding, resources, the financial cliff edge, the end of furlough, the impact of local authority positions on grants and contracts, loss of trading income. There is no end of ways to describe the financial impact that groups are experiencing and seeing. Access to kit and equipment to be COVID safe, how they got back in, how they started to operate again, an increase in demand with much more complex needs. So a bit of an NHS word, but the increase in acuity. So what's happening in communities, what's happening to individual people, becoming more and more complex. You're on a bit of a yo-yo, back in and out of responding, and I think we should all just pretend we're not recovering and just carry on responding. But that kind of fatigue around continuing to respond, changes in terms of health. So on top of this impacting us, the kind of changes in the health landscape, geography, commissioning, relationships, resources. I suppose one of the things that we're all affected by still is the impact of all of these complex issues on groups, alongside the fact that, you know, we've had a programme of austerity for 10 or more years, and the places that we live and work in are already impacted by that. And that was the starting point for the Northwest, I think, when COVID began. How are we responding as infrastructure organisations? So I talked to some of my colleagues very quickly earlier this week, and we've pulled together what we're doing. So we thankfully are quite a neat city region, we have a CVS in each of those places, and a really well established way of working across the city region through our partnership called VS6, which includes all of the CVSs, the Community Foundation for Merseyside, Merseyside Youth Association, Network for Europe, VOLA, and is really, really superbly supported by Voluntary Sector Northwest. And I think we had that in place, and in part that's what's helped us operate. So we do that really well in the places that we work, but in terms of being able to connect in to the conversations at a city region level, that's really helped us over the last 6 months. And then we've done loads of stuff around the kind of strategic input. So we've had a series of assemblies at a Liverpool City region level to brief the sector, to connect the sector's experiences and views into the strategic role we all play as infrastructure organisations. Some great stuff in terms of recovery, pictures and paper, lots of access to information and local briefings, and the data and insight gathering across the city region, so that politicians and leaders and policymakers understand what's happening in the sector and how we help the sector respond.